Everyone tuning in. My name is Rachel. I'm the head of coaching with Agave Health. Today with me, I have Dr. David Sitt. And what's your new title again?
Chief Clinical Officer, I
Okay,
think is
I
the
always
words that fell down. I don't know.
combine the old one and the new one, and I get it wrong.
Sure.
So David is our chief clinical officer at Agave Health. Um, do you want to just tell us a little bit about your background?
Yeah, sure, of course. So I'm a clinical psychologist by training, meaning I went to graduate school and got a doctorate degree back in the early 2000s in clinical psychology. I've been also working I've been a professor at Baruch College, where I still teach. I'm part of the faculty. I've been there for coming up on 25 years now. And my area of interest has always been in adult ADHD because I was diagnosed myself with ADHD and dyslexia at the foot of graduate school, and I think the year was 2000 or 2001. And just I threw everything at trying to understand what that meant and trying to find resources. And eventually, I wrote a book on the topic called ADHD Refocused, and found my way over to the team at Agave early in, and have been part of the journey here at Agave from the get go. And so that's a bit of about my background. I'll say one other thing that my wife and I, my wife Ayla, Dr. Ayla Sitt, um, we have 4 children, 2 of whom we know are diagnosed with ADHD. Um, my mom, who may be out there watching, also is diagnosed with ADHD, and so like my relation with ADHD is kind of full spectrum across the lifespan, and in the fishbowl and every direction that I that I seem to turn. So that's a bit
That
of
is so
background.
cool that it's something that affects you at different levels in your family. Because I know, like we've talked with a lot of people at Agave where it's like it probably runs in the family, but older generations of the family are completely unaware that that's why that's hard for you, or this is why things feel a little different. Um, and so I just think that's so cool that it's something that you're aware of and addressing at in multiple generations. That's amazing.
Yeah, yeah, it's an interesting perspective. You know
Well, in
that
future
that
generations, that's what it's going to look like because the
yeah,
landscape
exactly.
is
I-
changing,
I'm
which
I'm
is why
I'm
we're
in a
here.
sandwich generation of ADHD. I mean, but I too like the meat in the middle is also right experiencing. So it's like a
Absolutely.
full rounded experience. Yeah.
That's
I'm
so
excited to
cool.
talk today with you, Rachel, about what we're up to at Agave in terms of diagnosing ADHD in the post-pandemic world, and see if we can shed some light for our listeners out there.
Absolutely. And so one of the main reasons why I wanted to have you on to talk about this, just a little context for myself from my perspective, up until around 2020, I really hadn't even really given much consideration to adult ADHD. I knew that people could be diagnosed as children. What I had kind of heard throughout my life is like, oh, that's something that kind of like goes away, which as we know, it doesn't. So, I fell into that perspective that a lot of people had. And then 2020 happened. And I feel like the entire landscape has changed since then. And it's only been 5 years, and so much has changed. Um, and I know I'm not the only one in that boat and who had that perspective. And so I thought we could start us off, talk a little bit about just what has changed over the decades, since this is a field that you've been in for many, many years, and kind of what you've seen before 2020 up until now.
Yeah. So I guess I could begin this kind of sharing the thoughts, going back to even my own diagnosis and I was diagnosed back in 2001 or so, and I was trying to seek out care, and I live in New York and New York City, and when I went out to reach out for care, there were no specialists that understood, or no psychologists or psychiatrists that when I would meet with them, had understanding of the adult ADHD experience. I ended up with a child psychiatrist
Wow.
and with a therapist that also only worked with children, that I asked, please, like, what can we do for me as an adult? And it was a stretch. Meaning, and at the time, the DSM, the Diagnostic and Statistical Manual of Mental Illness, only really gave a definition of childhood and adolescent ADHD. Um, so the landscape was primarily child focused. Um, and now we fast forward, things change drastically. And in recent years, the dialogue about the adult experience, the fact that these children grew up,
Yeah.
right? So all the children that we in the 80s and the 90s when we started to talk about ADHD, um, grew up, and we needed to understand that manifestation of ADHD in adulthood, and maybe for children who weren't people that weren't diagnosed as children, but now are, we'll talk about this, emerging, and we're seeing the challenges of life. And the lens we now understand was that their ADHD is their challenge as an adult. We didn't identify it as children. We missed it for whatever reasons. It wasn't identified, and so the landscape really changed. Where today we now understand the adult experience of this, and we changed. It's not just the hyperactive child jumping around the classroom. There's many of us that weren't jumping around the classroom, and today, we've been able to shift the lens.
And how did the pandemic itself act as a tipping point for so many adults to start exploring, like, is this me? Is this something that I'm dealing with?
Yeah, it's a great question. And during the pandemic, I remember having my own, like in my own private practice, a surge in people reaching out and to ask about ADHD. And what became apparent was that the structure, the scaffolding of daily life, whether it be your commute to work, or office norms, or the routines of what are expected, they all collapsed during that time period, and it really unmasked a lot of the difficulties of focus and time management and motivation that were easier to kind of like tap into before, but now they're gone. And so this remote work really blurred the boundaries, and the demands shifted to, you have to be self-directed. You have to manage your own time. You have to know when to shift from one thing over to the other. And that challenge led many people to finally experience those difficulties of executive dysfunction that prior they may not have been as keenly aware of. So that was one thing. Mental health strain and stress also emerged for adults, requiring more people to seek out self-care. And while they were doing that, you're seeking self-care, part of the evaluations were anxiety, depression, and people were asking more about ADHD. And so more people in that exploration learned, wow, the anxiety, the stress, the burnout that I'm going through is not just anxiety, stress, burnout. But for many people, they learned, because they were given these assessments and evaluations, that maybe ADHD is a part of the case.
So, and one of the reasons for myself, this wasn't one of the questions that I told you I would be asking, but you just kind of got me thinking. Um, I know for myself, it came to a head via social media. Everyone was talking about it. So, what role do you think social media had, good or bad, when it comes to this sort of awareness of adult ADHD?
That's also a great point. And anyone who's out there in the TikTok or Instagram or any of the social media platforms that pump out content to us can tell you that there was a tremendous surge in the dialogue and the discussion of ADHD or executive dysfunction or neurodiversity. It trended. The trending spiked. I can't tell you the exact number in that space of how many x-fold we experienced, but it was notable. And that fed into the stigma dropping. The fact that people were talking about it, the fact that in the social media space, people got more comfortable speaking about mental health or mental health challenges.
For sure.
And so it became commonplace. So everyone's talking about the fact that they miss their appointments, or they're procrastinating, or they have their ADHD issues and their anxiety, et cetera, et cetera. So that was a huge contributor to the uptick in awareness about ADHD. More people reached out to learn more, and communities formed. The advent of community building through social media was significant. Even I always forget the name of a platform that emerged during COVID, where we would go and you would listen into to rooms of people speaking about whatever it was. Forgot the name of it. Not Parlor. Any event. ADHD was a huge topic in that new social media platform. Everyone was talking about it. So that would be my answer.
Awesome. Well, thank you for that. I it's with social media, you can focus a lot on the negative impacts, right? The kind of pseudoscience that gets pushed out, the self-diagnosis and whether or not that is remotely accurate, the misinformation and all that. But it's very refreshing to hear, positive outcomes that come from the advent of social media. Um, so, all right, we're at 2020. Um, the pandemic, social media, everything is creating this huge shift in awareness of ADHD. How did that surge of diagnosis and awareness impact the ADHD care landscape? What were some of the challenges that we faced, and are still facing?
Yeah. So during that time when this awareness spikes and the chatter and emerges and the stigmas start to drop and more people are seeking out care than ever before, we then, and we saw the fact that there weren't enough trained providers that understood ADHD, that were trained in their graduate programs about ADHD, whether even in the primary care space, just primary care doctors. We have research that shows that only 8% of primary care physicians, which is very often the first line where people go to kind of state their challenges or their complaints, only 8% of their doctors even knew about adult ADHD. And on the professional mental health space, not enough clinicians are available to diagnose or to treat. And so wait lists of 3 to 6 months emerged to even sit with the therapist that was trained well enough to assess, let alone treat. We saw a tremendous drop in availability of medication. That was a whole nother drama, that once you were diagnosed, now you wanted to get care. And one of the first lines, certainly in children and adolescents, is medication, and it wasn't available. And so now what? Now, if I can't get my medications, but I need behavioral care at least, and I can't get that, this bubbled a huge, it created a tremendous demand for care, but there wasn't enough available to meet that demand. And so that's one of the reasons why companies like Agave emerged, because we were leveraging technology and the ability to scale availability, the ability to drop the long wait times and provide access to care even in rural areas, because you can use technology to reach out and get that care. And so there was like this problem that arose, and then there was some that rose up to meet the demand.
Yeah, I feel like there are a lot of companies have tried to fill the gap. Maybe they can't fill each of the gaps that are created. Like medication, you were saying. I know people that it's 2025, it's May 2025. Still today, I'm hearing from friends and neighbors, like, I can't find my kids' ADHD medication in stock anywhere. Like, it's still an issue. And while that issue persists, because ADHD medications and the regulations that they are subject to, other solutions are emerging, which thankfully are resources there for those in need. Can you tell me a little bit more about what the diagnostic process looks like today? You mentioned that you can go to primary care, but like, what are the avenues that you can take to seek a diagnosis? And what are the barriers that people are facing? You had mentioned wait lists, things like that.
Yeah, so the challenges are still there. The challenges that emerged during COVID of a difficulty of access of care and finding trained clinicians that know the neurodiverse experience still exists today. So while many solutions emerge that are providing general mental health care, there are many large companies out there. It could be a Spring Health or or Headspace or other great, amazing companies, most of them take a general approach and aren't still yet providing clinicians that are trained in knowledge of neurodiversity. So what a diagnosis would look like would be finding a trained clinician that understands neurodiversity and can provide a process of assessment, which would include a what we call kind of a semi-structured diagnosis. And this is what we do at Agave. This is what, because this problem exists and no one was really filling it adequately, this was one of the things that Agave emerged to provide. And so I'll describe what we do at Agave. What we do is we provide a 3-part evaluation where a member can sign up for services for a ADHD or neurodiverse evaluation, and typically within a days, or maybe at most, maybe it's a week before we can get them into the schedule. And the first time we meet with someone, the first session, we're doing a full kind of larger context evaluation, because you must rule out the things that might look like ADHD, anxiety disorders, depression, trauma, and other variables. So, people say, oh, I went online and I filled out a survey, an ADHD survey, and they told me I have ADHD. That's all you did. You answered 6 questions online, and now you think that's enough to give you a diagnosis? That is false marketing by whoever it is that you went to, because you need a comprehensive process here. And so the first thing we do is we assess all these other arenas, as well as full background about your life. Second time we meet with you, we're doing a deep dive into ADHD using evidence-based approaches. Again, evidence-based. This is based on research that shows that using a structured evaluation of all of the symptom areas that might present for ADHD, we evaluate along each one of those lines, not just where you are today as an adult, but we have to also inquire about your childhood, because this is a developmental brain style. It doesn't just show up out of nowhere, although there is data that started to talk about that question. Today, we still consider ADHD developmental. We have to establish that childhood or adolescent presence. And so all of that deep dive happens in our second meeting. And our third meeting, we take all that information from the first and second meeting comprehensively, and then we present our findings. Is there ADHD? What's the subtype that might be there? Maybe it's alongside a comorbidity like a trauma or anxiety or depression. And with that information, we help you design a treatment plan. What do you do with this information? What's available? What type of resources we have at Agave? And what might be available beyond that can help you figure out what to do with your life at that point forward. So that's what a deep, bona fide evaluation would look like.
Can you imagine what that having those resources kind of pulled together for you like that would have been like 25 years ago?
Oh, that's
Life changing, right?
yeah, game changing. 5 years ago. I mean, many people think that you need to go get a neuropsychological assessment for ADHD, and that is not true for adults. For children, where you're designing an education plan, and when you have to fill out your state's plan for educational resources, they may require that, and it's more nuanced. Adults do not need a deep neuropsychological test in order to determine a diagnosis of ADHD. A comprehensive evaluation, such as what we've designed at Agave, is a sufficient method of getting a bona fide evaluation. In a rare case where we need to do a deeper assessment, we might recommend a neuropsych or cognitive assessment. But it's clear. It's important that people understand that differentiation.
You mentioned neuropsych evaluations, and just I know that especially for children, I've got my son on a wait list. They said it'll be 8 to 12 months before we hear anything, and I'm sure it's probably about the same, maybe not as bad for adults as well. But I also know, people go to their PCP, and sometimes they are comfortable going there. And then other times you'll have maybe a psychiatrist that speaks with you to an hour, and then says, okay, you have ADHD and here's some stimulant medication. What are the risks of that rushed or overly simplified diagnosis?
So it's important to understand the differentiation, as I spoke to it before. A rush diagnosis that doesn't take into account other factors that might a present as if ADHD, and so they need to be assessed comprehensively. The danger is that if I go and I get a diagnosis and there's a kind of a shotgun diagnosis of or a quick draw diagnosis of ADHD because of my rudiment, like a brief assessment, I'm not prescribing medication for ADHD that really was a trauma issue that ended up presenting with distraction and difficulties with organization and emotional dysregulation and all what could look like ADHD, but really was a reaction to a trauma that occurred, several months ago, a year ago, years ago. That's a big miss, and that you're mistreating someone in that way, and they're not actually going to lead to long-term effects of that. So it's quite important to be able to get these comprehensive evaluations. There are psychiatrists that do those comprehensive assessments that might do things similar to what Agave might do, but it's not common. It's not common. It's very necessary to get the right type of an evaluation.
I don't remember if I told you this, but like a lot of people, your awareness of ADHD increases. You start thinking, this kind of sounds like the calls coming from inside the house. I went to a psychiatrist and I said, I'd like to be evaluated for ADHD. And I explained the context, like I'm learning a lot about it through the company I'm working for, and I feel like this might be what I'm experiencing. And they told me, go to go to this website. If they diagnose you, we'll prescribe the pills. And I'm just like, back up a step. I've never heard of this company before, this website. So I was like, this feels weird. It feels
Right.
strange. But what do you remember the stats on the CDC gave out about telehealth and ADHD care? It's a huge
In terms of what? In terms of how?
just like the necessity of telehealth care and the prevalence of it.
Yeah. I mean, this, what I know from the CDC stats, are really about the diagnosis, the spikes, and the fact that adults are 4 times the rise in ADHD diagnosis has been 4 times fast, greater than even what we're seeing in the childhood space. We're seeing stats, in the workplace, 20% of the workplace adults in the workplace are have ADHD or neurodiversity. The numbers are really rising in terms of the ability of telehealth to support that. I don't know the stats on that off the top of my head in terms of what's being met, right?
I actually have a stat right here I wanted to talk to you about.
Yeah.
So the recent CDC data showed that around 15.5 million adults have an ADHD diagnosis, and about half of those were received in adulthood. If you got so far in life that you're only just now considering that you might have ADHD, what's the value to actually seeking a diagnosis at this point?
It would be the same as me finding out that I have diabetes, or the same as me finding out that I have a cholesterol issue, right? That there are you can't necessarily see so easily, but the effects are there. And if I don't address this internal kind of state of my body, problems will begin to emerge if they aren't already there, right, and causing difficulty in your life and dysfunction in your life. Receiving care is essential to help bring balance. My philosophy about ADHD is about, because it doesn't go away. It's not like I could give you this treatment or this pill or this approach and it will disappear. It's an ongoing, there's an ebb and flow to ADHD. And this is about increasing the probability of success, cranking up your probability of success. And how can I increase my probability of successfully managing my day-to-day life and my work life and my social life and my family life? It's with mindsets and methods. I need methods to apply. Right. So at Agave, we have a whole coaching suite, right, that you lead, where Members are learning methods to apply to their daily life to help them improve their probability that they'll have a better day that day or a better week that week, right? And there are mindsets that also are taught. So, our therapists come in and they help teach people the cognitive behavioral therapy model of perspective taking and understanding how that can lead to guilt and shame and depression and anxiety. What tools can I implement? What methods can I implement to alleviate those challenges? And what philosophies, what mindsets, mindfulness can I bring into place to help me be better prepared for the fact that I'm not going to have a great day every day? To the fact that even if I put my best effort in, it's still going to be I still have a challenge here, but a philosophy of self-forgiveness and self-acceptance, these can increase my probability overall. Maybe I'm not going to function at 100%, but if I could get to a solid 80%, and even if I dip down to 50%, but I know how to move up on days, that's going to change my life. And knowing my diagnosis is going to help me receive and reach out for the right kind of care to improve my daily living. And that's what we at Agave are about. That's what we in the ADHD community are about.
I see a lot of that sort of internalized guilt and shame. Speaking with the coaches about the people that we're working with at Agave, and just the ability to see that change slowly over time, and working with someone who understands where you're coming from and and helps you to remove that, like, this is my fault, or this is, I am bad, I am whatever, sort of negative thought pattern there exists. It's just a joy for me to see that shift over time. And with everything that's changed in the ADHD space over the last few years, what excites you the most about the direction that ADHD care is heading?
I think that we are in an amazing. We've turned the corner here because the dialogue in aggregate has really emerged. Meaning we meet with many companies over at Agave, and I'm so excited when I sit with a company that for example, like NVIDIA is a company that we speak to regularly, and we're rolling out hopefully our services in the near future. And they have a group of employees that are organized in their own community, and all companies have these. Google has these companies, has these ERG groups, these employee groups, and they have their own community that discuss their challenges with ADHD and neurodiversity and explore solutions together. And so I'm excited to know that that the stigma has dropped enough so that enough people get together and say, I have this brain style. And in fact, we have this whole strength-based approach to ADHD. We've moved away from the medical view of ADHD being something you're broken with and there's a problem with you. There are challenges, but it's just like a software, different operating system. Neurodiversity means I have Windows, you have Mac OS, you have Linux, and there's strengths and weaknesses to them. And I'm excited to know that people get together and have community. And even in Agave, we have our own community resources. So that's one of the areas that I'm most excited about. And the second is that we have advent to great resources now. Companies like Agave and others are out there making it available and reducing the wait time and reducing the barriers to access to care is incredible. And the fact that we are also understanding different subpopulations, the differences in women, it's a whole nother conversation. Differences in women with ADHD, differences in minorities that struggle with ADHD, and what does that look like, and how we can step up to provide access of care to all groups. So that's what excites me most.
I think that is a perfect spot to end today, just on that beautiful high note. Thank you so much for discussing this with me today, and everybody watching the replay. We appreciate you, and we're here for you if you are looking for adult ADHD care. David, what states are evaluations available in currently for anyone watching?
So right now we are live in Florida. So when we say evaluation, we're available across the country for our coaching platforms
Thank
and
you. Yeah,
for
very
our
true.
CBT resources and for our community service. We're available across the country for all of that. You can go onto the app, download the app, and receive access to our care. If you need an evaluation, diagnosis, and or therapy, which is done provided by our licensed clinicians, that's rolling out state by state. Currently, we are in Florida, we are in Pennsylvania. New York is launching now imminently.
Awesome.
Any day now that will be coming out. And so those are our primary states, and we're rolling out many other states in the weeks ahead.
And we'll be sure to let everyone know when we're live in a new state for our clinical services. Thank you again, David. It's great talking to you. And we'll see you all next time.
Bye.